In this video, I'd like to talk about the AC maintainer, also known as the anterior chamber maintainer. And this is used in complex cases like sutured IOLs to maintain the infusion in the eye. So as an example, often with complex cases, you need to use both hands. So you need to use microinstrumentation with the right and left hand, and you don't have another hand to provide infusion. So what you do instead is you use the AC maintainer, and the AC maintainer acts like what I call the third hand in complex eye surgery. What you do is you take this metallic tip and then you create a paracentesis incision and you place it right there. The other side of the tubing here is attached to the infusion line of your cataract machine. Now, it's important that once you place the metallic tip here, that the tube remains stable. So you can use a steri strip and you can apply it here or around the infusion line, because you don't want the tube to move. If it moves during the surgery, it can hit the endothelium, and more importantly, if it's loose, it can come out. And if it comes out, that can cause serious issues. Now, in complex cases, you want to maintain a firm globe. If you don't, so for example, if we do scleral fixated lenses or things like the Yamani technique, where you're making sclerotomies, basically holes into the eye. If you don't have infusion, then there is a possible risk of a Supra choroidal hemorrhage. And this is arguably the worst complication in ophthalmology. And this happens when the eye is soft. You prevent the eye from being soft by placing infusion line. And so, out of all the steps in these complex cases, having a continuous irrigation on at all times is key. And I do want to point out that on most phaco machines, there's a button that allows continuous irrigation. What do I mean by that? It means that the fluid will run through this incision throughout the entire case without you having to use the foot pedal or having to remain on position 1. If you want to eliminate the number of steps that you have to do, it makes the case easier. So hit the continuous irrigation, place the AC maintainer, and then, only then, can you proceed with the subsequent steps of the surgery. This will provide a very safe environment for you for the case. Now, of course, there is anterior infusion, and some anterior segment surgeons will, instead of placing an AC maintainer, they will provide posterior infusion. And all retina specialists administer posterior infusion through the pars plana. There are pros and cons for each. In terms of the AC maintainer, the main pro is that when you're working on dislocated lenses or suturing lenses or fixating lenses with flange techniques, you're working in the anterior segment and you want this area to be pressurized. If you're providing infusion through the AC maintainer, well, the fluid will be right where you're working. And so it's a little bit more efficient that way. When you have posterior infusion, the fluid is being administered in the back of the eye, but you're actually working in the front part of the eye. So that's where the anterior chamber shines. One of the downsides is that the AC maintainer is closer to the cornea. And closer to the cornea means that it's more likely to have trauma to the endothelium, whereas posterior infusion is further back, of course, and so there is less concern for endothelial injury. And that takes me to one other point. I will start the AC maintainer when I absolutely need to. I don't want continuous irrigation if I'm not actually doing anything during the surgery, because remember, all the fluidics does make contact with the cornea and of course affects the endothelium. So what am I referring to about proper placement or when is the best time to place an AC maintainer? Well, let's talk about the Yamani technique, for example. So in the Yamani technique, before you even do the sclerotomies, you spend a considerable amount of time marking, and having adequate centration is key. And so Marking can take a few minutes, especially if you want to get everything right. So right now, if I'm marking 2.5 millimeters back from the limbus, 2 millimeters across on both sides, I don't need to put that AC maintainer right now. To me, that is an infusion line, and it's next to the cornea, and I'm not doing anything. I will only activate the AC maintainer once it's time to actually do intraocular maneuvers. So when I'm outside the eye, I don't need to put the AC maintainer. So that basically wraps up the video here about an AC maintainer. It's a very important device to have for any of these complex cases. One last thing I should mention is that some AC maintainers are reusable and some are single use. This one in particular is single use. I have a Lewicki AC maintainer that's reusable. It's just sent down for sterilization. Both work equally well, and as I said, they're very easy to put in, and as I said, they're essential for complex eye surgery. I hope you found this video to be useful, and thanks for your attention.